All right, welcome everyone. My name is Mayela Arana, and I'm a Senior Program Manager in Workforce Development here at the Public Health Foundation. We are absolutely thrilled that you've chosen to spend the next few days with us virtually as we dive into this year's exciting theme, Workforce Development in Action. Over the next 4 days, we've lined up some amazing sessions that will cover everything from retention recruitment to diversity, equity, and inclusion, to the latest tools designed to strengthen our public health workforce and build capacity within governmental agencies. But this isn't just about sitting back and listening. Each of our speakers has prepared a call to action, challenging you to reflect on how you can apply what you've learned here in your own health departments. So as you enjoy the sessions, we encourage you to think about those light bulb moments and what actionable steps you'll be ready to take back to your team. We're excited for an incredible week ahead, and we can't wait to see the energy, ideas, and connections that will come out of it. Before we jump into our opening session, we have just a few housekeeping items to go over. Throughout the week, you can join your audio on your computer or by phone. We kindly ask that you keep yourself on mute when you're not speaking to avoid any background noise and to help our presenters shine. If you're willing and able, we encourage you to turn on your cameras to create a more engaging and connected experience. All sessions are being recorded and will be available on the Train Learning Network in the coming weeks. Once the recordings are live, all registered participants will receive an email with the details. We're thrilled to have such an incredible lineup of speakers at this conference. To learn more about them, check out our speaker bio book in the supporting resources section of the conference page. You just have to scroll down beyond the session information and you'll find it right there. Your feedback is also incredibly valuable to us, so please take a moment to complete the conference evaluation. This year, we have a single evaluation for the entire conference. Don't worry, we will send you a reminder email after the event to ensure that we hear from you. Lastly, we would love for you to connect with us on social media to share your insights, photos, and experiences throughout the conference. Don't forget to use the hashtag WFDInAction. We would like to begin by acknowledging the Indigenous peoples of all the lands that we occupy today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we all call home. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast, we acknowledge the ancestral and unceded territory of all the Indigenous people that call this land home. We recognize the traditional owners of the different lands we work on today and the Indigenous people participating in this conference. We pay our respect to all elders, past and present, and acknowledge and celebrate the diversity of Indigenous people and their culture and connections to and stewardship of the land and water. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we are and can each in our own way try to move forward in a spirit of reconciliation and collaboration. I am now delighted to turn the mic over to Joe Finkbonner to officially kick off the 2024 Public Health Learning Forum. Joe Finkbonner is the chair for the Public Health Foundation's Board of Directors, the former executive director of the Northwest Portland Area Indian Health Board, and past chair of the Public Health Accreditation Board. A member of the Lummi Nation, he has dedicated his career to improving American Indian, Alaskan Native health through roles in tribal health, policy development, and healthcare delivery. Joe, I'll turn it to you.
Thank you, Mayela. Good morning, everyone. Good afternoon for those of you on the East Coast. On behalf of the Public Health Foundation Board of Directors, I'm delighted to welcome you today to the 2024 Public Health Learning Forum. As a national nonprofit organization focused on strengthening our nation's public health infrastructure, we recognize how essential it is to have a well-supported and skilled workforce to serve our communities. This is why we have focused this year's Learning Forum on workforce development in action. Our intent, as Mayela mentioned, is to leave each of you with actions you can take to address public health workforce needs. I'd now like to introduce Dr. Leslie Ann Dauphin, Director of CDC's Public Health Infrastructure Center, Dr. Doffin's center focuses on supporting efforts of state, tribal, local, and territorial health departments and having the people, services, and systems needed to promote and protect health in every community. Dr. Doffin will now offer a few welcoming remarks on behalf of her center. Welcome, Dr. Doffin.
Thank you, Joe. And good morning and good afternoon, everyone. So as Joe mentioned, I am Dr. Les Doffin, and I'm director of CDC's Public Health Infrastructure Center. And I'm really thrilled to provide some opening remarks here today. I'd like to start by saying that at CDC, we recognize that our public health workforce is our greatest asset. We simply cannot do the work of public health without a strong, competent, and diverse public health workforce. These are the folks who are on the front lines every day, protecting health and improving lives across the nation. And we know that right now in this nation, we are facing a workforce challenge. So a particular focus on workforce is critically important at this time. I thought I'd start by just saying a little bit about our center and the role that we play in promoting and advancing the public health workforce. And I should share, though we are titled the Public Health Infrastructure Center, we actually are the only center at CDC that has workforce in the name. Our center is the national center for state, tribal, local, and territorial public health infrastructure and workforce, which really highlights our focus in that area. We realize that's a big name, and we shorten it to infrastructure, but it's a big name because we really have a big mission in supporting state, local, and tribal and territorial public health departments, as well as advancing our workforce. So partnerships like our work with Public Health Foundation are critical for that. And I am delighted and thrilled that there is a focus on workforce development in action, so that you're actually learning things that will help and you can actually have action following this. I wanted to highlight also a couple of collaborations that we have with Public Health Foundation, beginning with CDC Train. And our collaboration is through our Division of Workforce Development. As I mentioned, having a focus on workforce as a center, we have an entire division that is dedicated to doing work and moving this effort forward. Some of the ways in which we do that is through our fellowships and internship programs. Our center is the center at CDC that manages 11 of CDC's fellowship programs, and these are creating pipelines and pathways for careers in public health. And the other area, which is a huge focus, is on training and professional development. I mentioned CDC Train because this is really an impactful utility for public health professionals. Right now, the system offers courses to more than 5.6 million learners, and 2 million of those are actually accessing training directly through CDC Train. We know that a strong workforce is critical for moving public health forward. We want to continue our partnerships with partners like Public Health Foundation to advance workforce and to provide the support that we can to health departments across the nation. I realize I was only given a few minutes, so I will stop there, but I do hope that you enjoy the sessions today. And I want to thank you for the valued partnership with Public Health Foundation for setting up seminars and events just like this. And with that, I will conclude and turn it back over to Joe. I hope you enjoy the sessions.
Wonderful. Thank you so much, Dr. Doffin. Okay, so now I would like to turn it over to Ron Bialek, President and CEO of the Public Health Foundation, who will moderate our opening panel, Building Bridges, State and Local Collaboration in Workforce Development Action. Ron?
Thank you so much, Mayella. I'm really excited about this intro session and actually all of the sessions. But as Mayella mentioned, I'm Ron Bialek, President and CEO of the Public Health Foundation. Workforce development is central to our mission here at the Public Health Foundation, and we're delighted that you're joining us for our 2024 Public Health Learning Forum. Our initial panel will focus on state and local collaboration in workforce development. We have a wonderful panel from Kentucky who will be talking with us about the strong state and local partnership and collaboration that exists in Kentucky. Our panelists for the session are Dr. Stephen Stack, the Commissioner of the Kentucky Department for Public Health, and he's also the President of the Association of State and Territorial Health Officials. Tabin Harrington, who is the Chief of Staff of the Kentucky Department of Public Health. Rebecca Gillis, the Director of the Division of Public Health Protection and Safety of the Kentucky Department for Public Health. And Sarah Jo Bess, who's the Director of the Lincoln Trail District Health Department and President of the Kentucky Health Departments Association. And that association represents all of the local health departments in the Commonwealth of Kentucky. The full version of all of the presenters, as Mayella mentioned before, all the versions of the bios can be found in the resource section on the train for the conference. The learning objectives for the session are for participants to be able to describe the partnership between state and local health departments in Kentucky, to explain the benefits of a strong partnership between state and local health departments, and describe how state and local relationships contribute to a more vibrant and productive public health workforce. Our call to action and our hope for this session is that by its conclusion, you'll consider ways you can contribute to building stronger relationships between public health agencies where you are working, studying, or volunteering. Without further ado, let me turn this now over to Dr. Stack to talk with us about workforce development and the state and local collaboration in Kentucky. His opening remarks will be followed by remarks from each of our panelists. Dr. Stack, let me turn it to you now.
Thank you very much, and good afternoon. In the way the World Health Organization begins it, good morning, good afternoon, and good evening, so that we cover you wherever you happen to be. So hello to everyone and welcome to this multi-day conference. I hope you find this to be a rich and fulfilling and educational experience. Before I talk about Kentucky, though, let me first thank the Public Health Foundation for hosting these activities and for investing in the workforce that you work so hard to train. And let me thank Dr. Dolphin. We're not going to go into very much the federal level here in our panel today, but the partnership we have across all three levels of government, local, state, and federal, is really invaluable to supporting a strong and healthy public health system. The public health infrastructure grants and the workforce development grant that came before it were long overdue and long necessary investments in a public health system that had unfortunately withered away over a very long period of time due to underfunding and underinvestment. And so I want to thank and compliment CDC and the Biden administration for investing in the public health workforce so that we can all benefit from having a robust collection of professionals who are work ready and available to be able to support the people we serve. So back here in Kentucky, I began my journey as commissioner in 2020, 1 month before the COVID pandemic. So I began February 10th, and our first COVID patient was announced publicly on March 6th. At that point in time, when I came into my office and met my team, there were a lot of vacancies in a number of the key positions. In addition to there being vacancies in the key positions, there was a workforce that had been subjected to 5 commissioners in 5 years. That instability really degraded the culture of collaboration and partnership. It's very difficult for teams to perform when there's not consistent and stable leadership. And so we entered a crisis, I think, with difficulties of an insufficiently sized workforce. There weren't enough people on the bus, and we didn't have the right people in the right seats because we had a lot of vacant seats. And those gave us significant headwinds in addition to the COVID pandemic itself. Be that as it may, we quickly rallied and came together. And one of the things that was apparent from the very start was due to that turnover, I think, in the commissioner's office over those previous 5 years, the relationships between the local and the state health departments weren't as healthy and as vibrant as they needed to be. And so there were things that the state was not doing to convene and organize activity, and communication that wasn't occurring with our partners. And the Kentucky Health Department Association, our SHO for Kentucky, had stepped into that void in certain ways and had been trying to facilitate and coordinate meetings and collaboration. So I think people were trying to do the best they could, but it was not as organized or as openly collaborative as it needed to be, I think. And so that's how we began COVID. And I suspect that's not a story uncommon to you and other states as well. What we did do, though, as we went forward, is we focused on how do we build a culture and a team of cooperation, mutual trust and respect and partnership. And so we worked on trying to foster and promote communication in a lot more robust ways. Of course, we all did that using Zoom throughout the pandemic, and we communicated a lot more than was typical, I think, before the pandemic. And then the CDC put in place grants to support us, both for the disaster response, but then also for education and for training of our workforce. We swung into action to use those resources to further enhance our efforts. So here in Kentucky, we're what is described as a shared governance model. I have certain responsibilities under statute as the state health official. I have obligations and accountabilities. There are certain things I have to do to enable or support the local health departments. There are things the local health departments are required under statute to do and to perform. But it's much more of a situation where we are profoundly entangled, and that there's always clarity about who is the person at the end of the day who has to be accountable for certain things. In such a system, it really is a profound imperative that we work together and that we get along with each other and that we trust and respect each other, because we have to find ways to agree on a shared course of action. We have to find ways to compromise with each other and collaborate. We also have to find ways to be clear and open with each other when we sometimes find ourselves in situations that are difficult to reconcile. The local health departments have their own individual agencies to run in support of the communities they serve. I have the responsibility with our team at the state to oversee the entire state. Sometimes there's tensions between the obligations we feel and that we have to be accountable for, even though there's no disagreement between the people. The responsibilities we're given can sometimes be at odds. So finding ways to work through and reconcile those things is really important. And a big part of that is finding ways to invest in the leadership and training of our workforce. That includes everyone from me as the commissioner, all the way through to the folks who are working and the closest to the front lines, interacting with citizens as they come in seeking our assistance and help, or who are doing program level work. And so one of the key things we've done is invested a lot in our education and our training of our workforce. And at my level, for the folks I interact with very directly, we've defined the senior leadership team as all of our division leaders for all of our internal divisions and agencies, plus some other cross-cutting leaders who are in the commissioner's office, and also all 61 of our local health department public health directors. So Kentucky has only 3% of the United States population, but it has 120 counties serving those 4.5 million people. So we have the fourth greatest number of counties in the country, though we're only 3% of the nation's people. It's a lot of complexity for a relatively small population. Those counties are served by 61 health departments in Kentucky, most of whom are individual county health departments, but some are districts where counties have merged together. The smallest district has 2 counties, and the largest has 10 counties. So there's a lot of complexity here and a lot of different responsibilities people have to be accountable for. The leadership training that we've done when I started out involved first the internal senior leadership of the Kentucky Department for Public Health. And as Tabin will tell you in a little bit, we did a number of things, offsite retreats, in city and the capital city retreats. We read a number of books together. We did a number of activities that I won't steal all her thunder. She'll go through that in more detail. And we expanded that to also include the local health department leaders. So we've done retreats where members of the senior leadership team from the State Department for Public Health have gone to state parks, and we've brought outside educators and trainers in and also read some books together so that the public health directors, who are the principal health strategists for their counties they serve, could work in partnership with myself and some of our team members here at the state. This helped us to go on a journey of shared learning together, building a shared and common vocabulary for leadership and how we approach the tasks that we're responsible for. It also helped us to get to know each other so that it was easier to pick up the phone and just talk with each other when there's a problem or a concern. There's some themes that have come up over time to assume misunderstanding before malintent, when possible, to pick up the phone for difficult conversations, not to use email, which is frequently misunderstood. To do things like involve people in shared decision-making whenever possible. We treat information to the fullest extent we're able to as a common and shared resource for all of us to use to help support the people we serve, not as something we hoard or silo or keep to ourselves. We've also tried to eliminate one-person vulnerabilities and to create redundancies so that there's always more than one person who does any key task, so that we can take our off time to go on vacations and recharge, but the work can still get done when we step away from our job. So there's a number of different things we've worked really hard on to improve the health and wellness of our workforce, and also to improve and invest in the quality and the caliber of our leadership that we bring to bear. And again, I feel like I am stealing a little bit of their thunder, but they'll give more detail in the stories. We have partnered with ASTO to do leadership training for those who are supervising 2 or more staff members. And we've also partnered with a coalition of universities from Georgia to do another training session. One is called KEEP and one is called Kentucky or KFELI, the Public Health Executive Leadership Institute, I believe. And so the KFELI version of this is intended for folks who are emerging leaders who may not yet be supervising someone, but who are interested in becoming more of a manager or a leader over time. In doing these year over year, we have partnered to make sure we have the state and local layer represented at both of these, again, trying to build a denser network of interaction between the state and the local health department, so we see each other as friends and community members rather than as adversaries at times who are seemingly exist only to conflict with each other, which is, I think, unfortunately, all too often how these things work between layers of government. So along the way, I think a lot of people have met good friends and colleagues. I think we've had more coordination and collaboration across the state. And part of this is really manifest in CADA, the Kentucky Health Department Association's decision to align with a new program that we had created, which was a area health liaison program. So we took the entire state, divided it into 5 regions, and assigned what I would say is a concierge or a boutique sort of customer service agent between the state health department and the local health departments. And the goal here is to have these area health liaisons to be trusted and valued partners, both at the state and at the local level. They are not there to solve the problems, but they are there to find a person with the problem and put them in contact with the person who can solve their problem, and then track it until the problem is solved. The goal here is to try to train and build in the correct lines of communication so that program staff and execution staff at a local health department know each other and are working closely together, and where problems emerge, that someone can step in and try to help bridge that divide. Additionally, when we find that multiple local health departments are sharing the same concern, that suggests we have a systematic problem at the state level, and then the area health liaisons are able to roll that up and share that with us so that we can then address more systematically something that appears to be causing problems for multiple different jurisdictions. All of these things, I hope what you hear is that together we can go farther. And, you know, it's interesting, in the organizations I've been part of, in my prior leadership in the American Medical Association, one of our taglines was, "Together we are stronger." And when we went through COVID here in Kentucky, Governor Beshear, who I have the privilege to serve with, ended his press conferences every day with, "We'll get through this together." And so I think that's really, really important. We can fight and argue with each other. And sadly, it is political and presidential election season. And so we're seeing that all too prominently now on our television screens and social media, and the texts that unrelentingly won't stop. That conflict ultimately is corrosive and erosive to our society. It degrades our ability to come together, to see each other as friends and colleagues and as community members, and it interferes with our ability to achieve higher or better outcomes. And so we've worked really, really hard here in Kentucky to try to overcome those challenges, to work together and see each other as friends and colleagues, to go on shared journeys of learning and discovery together, and to value and appreciate each other's input and contributions. And again, as I go through this, I know what the folks after me are going to share, because we've had the great joy of telling this story in other places. they're going to show you some of the tools that we have used and some of the content we've done, and even show you some of the results we've achieved, which I could rattle off those too. I won't then steal from Becky too much, but I'm really proud of the accomplishments this team has done. And it really has been a partnership of about 1,000 people at the state and another 3,000 plus across the local health departments. So we've got a collection of over 4,000 people in Kentucky who I think have really worked hard and come together as a community of mutual support and trust and respect. And again, it wouldn't have been possible as fully as it has been. I think we would have done some of this stuff, but it would not have been possible at the scale we've done it without the wonderful support from the CDC, from the Workforce Development Grant, the Public Health Infrastructure Grant, and then the partnership and the technical assistance they provide through a variety of programs. It really has been an all three level of government initiative. And I'm really, really thrilled and happy that in Kentucky, I hope we have embodied the spirit of what CDC was trying to incentivize. And I feel confident that in Kentucky, we're in a much better place as a public health workforce to support the people that we serve. The big challenge now is, can we improve the health of Kentuckians? And so we're fully committed to that. And it's my hope that with this team that we'll achieve new levels of success to help support people in Kentucky. So thank you for the opportunity to lead off this panel and start. I think we're going to head on over now to Tabin, who's going to take us into the next section.
Thank you, Dr. Stack. Well, hello, everyone. As they had said, my name is Tabin Harrington. I'm the Chief of Staff for Kentucky Department for Public Health. And today I'm going to share with you a little bit about our organizational culture at the Kentucky Department for Public Health. And I'll get more into why we think that's important and how that culture directly impacts our relationships with and work with our local health departments. So next slide, please. So just a little bit about our structure. Kentucky Department for Public Health, we have approximately 1,000 employees across 8 divisions and an Office of Health Equity. Next slide, please. And as Dr. Stack had mentioned, we have 120 counties in Kentucky, served by 61 local health departments with a workforce of approximately 3,000. So our combined footprint of state and local public health system, we have about 4,000 public health staff serving across the Commonwealth. Next slide, please. And so, in looking to organizational culture, I think it's important that we talk about this, how we view culture as a State Department for Public Health, because that culture that we have impacts directly how we work with and involve and engage and include our local health departments. It is a part of our culture as a state department to be collaborative and engaging and responsive. And so whenever we have a positive workforce culture internally, that translates to how we work with and engage others, like our local health department partners. We also know the importance of a positive and supportive work culture on productivity and efficiency, the recruitment and retention, the engagement, customer experience. So all of these things. And I know that organizational culture is really important for all organizations, but I would even posit it's especially important for government organizations because the better that we perform, that means that the better we are able to serve those we're serving. So the better that we are as a department and as a public health system, ultimately that means we can better serve the 4.5 million Kentuckians every single day. And so we really wanted to focus on whenever our staff feel that supported, included, engaged, that we are able to be more responsive and attentive to the needs of our local health departments, and also collaborative in helping to engage and solve problems together. Next slide, please. So there are many ways in which we do this in helping to build a positive culture here, and it starts with meetings and leading those intentionally to build connection and collaboration across our different divisions and local health departments. So as Dr. Stack mentioned, we have our senior leadership team at Kentucky Department for Public Health, comprised of about 28 of the senior most state level leaders. And then we have our upper management team, which is the next level of leadership, which is about 70 people in that team. Those are branch managers or those who lead pretty large, complex areas within the department. And then we meet regularly with our local health department directors, which we have 61 of those. So we meet every month, myself and Dr. Stack, we meet with our local health department directors. We have different work groups of them. So we meet with different subsets of directors every single month. We have monthly update meetings from our Kentucky Department for Public Health leadership team and program staff. They present every single month. They actually just finished presenting right before this to our Kentucky Health Departments Association meeting. So that way we are giving routine updates on things that we're working through and areas that we could use collaboration and help with. We also have our annual retreat at the state park, and that retreat is a really important tool that we've been able to help create better relationships. And that retreat is with our senior level leadership at Kentucky Department for Public Health, so that 28 senior most leader level, with the directors of local health departments. And so we meet intentionally and these agendas intentionally with the purpose of really helping to build these greater partnerships and connections. And one of the things that we do at these meetings, next slide, please, is we lead together and we read together. So Dr. Stack mentioned this. One of the things that's really been helpful for us in helping to build this positive and inclusive collaborative culture that we have at the Kentucky Public Health System has honestly been like our book club. It's like a leadership book club. And so these are the 5 books that we have read thus far. It had started off with the commissioner and the senior leadership level team reading a book together, and then we'd have a retreat and discuss it of, hey, well, here's some themes that came out of these books. How can we embody this at Kentucky Department for Public Health? Or what are some things that maybe didn't work in this book that we would do different? Or we took this as an opportunity to see how can we, one, use the same language, the same reference, that shared vocabulary. So when we talk about language, like Dr. Stack said, getting people on the right seats on the right bus, that comes from these books, right? So we're able to have these similar references we're talking about. But more than just getting us on the same page, literally, as a senior leadership team of reading together, we then expanded this of we're reading books with our upper management team and with our local health department directors. So we have our local health department directors, our upper management teams, our senior leadership teams, and our commissioner's office all reading the same book together, coming together, talking through these concepts, exploring, asking some hard questions of, hey, how can we incorporate this within our department and how we work together? And then we can have a better shared vision. So these books, I highly recommend these, and we have a long list to get through in the future that we'd like to keep going through, but has been a really great tool for us to connect with one another and to also have that, again, that shared vision. Next slide, please. And so with that, we have an investment in our leaders, and not only an investment in our leaders, but we really invest in relationships, because the better relationships we have with one another, the better we're able to pick up the phone and walk through an issue and say, hi, how's it going, John? You know, I heard about this happening. What's going on over here? And we can talk through things that way versus firing off an angry email, sending an angry response, and then you have a long thread of emails that gets you nowhere, right? So part of our culture, again, that importance of the culture, I think it really starts at the State Department for Public Health and in fostering a collaborative culture. But part of that culture translates into how we work with our local health departments, and that's in a collaborative, engaging, and understanding spirit. So some of the ways in which we've invested in our leadership specifically are, we had a session from the University of Gatton College of Business, University of Kentucky. They customized a leadership program specifically for Kentucky state public health leaders. And we went through this leadership program in which they designed ways in which, one, we work better together as a leadership team, and two, how we as a leadership team can work better with our local layers of leadership. And then we have our LHD, our local health department directors and senior leadership team events. A few things that we've done at our leadership retreats are, we had our DISC personal assessments done. And that was really neat, because then we have a portfolio of, this is Kentucky's public health system leaders DISC assessment. We have from all of the team of leadership. So we can tell you, we have we are really full of a lot of people who are big eyes, or, like the influencers, or we have a lot of decision makers, and that really helps us work together, because whenever we're working with different directors, we have their DISC assessments. But we can also be like, hey, I see you really are a D, aren't you? And so that way it helps us communicate and work through some of these problems better. But to be able to do DISC assessments with 61 local health department directors and our senior level leadership team has really been a great experience in working to tackle problems and work together. We also did a leadership training on communication and how we can get better at communication as state and local agencies together. And we work hard to provide that unified message. And so that was a great training that we were able to all do together as well. And as Dr. Stack mentioned, we have 2 leadership programs, and these programs are intentionally not just confined to state or local, but we mix our state and local staff to go to the same public health leadership programs. And so then we can introduce and create stronger relationships between our state and local folks. So that's the Kentucky Enhancing Excellence in Public Health Leaders. That's a program designed for those who supervise folks or are in leadership positions at local health departments and the state level. And we also have an Emerging Leadership Institute, more for program staff who aspire to become leaders. And that is really important for the state and locals to meet each other at these different levels of their careers. And then they can foster relationships as they grow and move on throughout the organization. Next, please. And so that was a little bit about our culture. And I just want to talk about, how it really does start at the state level and setting that tone of whenever your staff feel supported, that they're invested in, that they're cared about, that they're uplifted and encouraged, you're more likely to have a positive response whenever you're reaching out to someone who's feeling like they're in a positive work environment, right? So not only you get a more friendly staff who's more ready to serve, but it's also a part of our culture to be inclusive and collaborative. And we see our local health departments as a part of this culture with us. This is how we operate as a Kentucky public health system. And I ended with this slide. I wanted to point out our Kentucky Public Health logo down at the bottom left. I think that really helps to embody how we see ourselves in Kentucky. That logo, it doesn't say Department for Public Health. That's not our state logo. That's Kentucky Public Health. That is a visual of state and local coming together. We are one public health system. We work together not to just serve a county or to serve a state. We work together to serve the people. And ultimately, whenever we work together, we can better serve the people in that way. So next up, I'm going to pass it on over to Becky, and she's going to share more specifically about how we've made these investments in our staff and in our local health department leaders and staff.
Thank you, Tabin. Again, I'm Rebecca Gillis. I'm the Division Director for Public Health Protection and Safety, which includes the Public Health Infrastructure Grant and Program. Next slide. I'm going to talk about how we've invested in Kentucky's public health workforce at both the state and the local health department level. Talk about the pathway that we have invested in to get young high school and college age students to pursue a career in public health. We're going to talk about the student internship program and some other programs related, such as the tuition assistance program, and also about our employee learning and development program, which will all works towards a fulfilling career in public health. Next slide. In 2021, as we came out of the most intense part of the COVID response, Kentucky Department for Public Health set forward our strategic plan looking to 2025, and we set 6 priorities. The priority I'm going to focus on today is the people priority. We had two simple goals as part of that, to attract and retain a competent and diverse workforce and cultivate a positive workforce environment for our staff. We set out with this goal, and that's what I'm going to focus my talk on today. Some of the things that we've done around that people priority goal. Next slide. Around that same time, we also saw an opportunity with the CDC COVID-19 Public Health Workforce Supplement funding, and then following that, the Public Health Infrastructure Grant. We saw that as an opportunity to really put more dollars and resources behind that people priority to accomplish those goals that we set out to do. We set a goal, and our overall goal for this funding was to recruit, train, and sustain a competent and diverse response-ready public health workforce. Next slide. Some of the challenges that we faced coming out of the very intense part of the COVID response is that we had asked so much of our public health employees during that time. Many of us worked hundreds of hours during that COVID response. Coupled with that, state employees had not received any regular raises since 2009. So we'd been more than a decade without raises in our state. And as a consequence of that, we were earning about over 22% lower salaries than the private sector. Only 20% of our staff at the state health department were at that midpoint salary, which is the highest level that we can bring somebody in the state classification system. The reasons that we saw for people leaving were pay disparity and low salary. They cited a lack of training and learning resources. Leadership issues were sometimes brought up. Workload and time constraints and uncertain career growth were all reasons that people were leaving public health at that time. Next slide. One of the first things that we did was put together a workforce development and infrastructure advisory committee. And so we brought in folks from the local health departments, our leaders across the Kentucky Department for Public Health and the different divisions. And we talked about how can we work together to recruit, hire, train, retain a public health workforce. Those meetings continue today, quarterly, and we have a number of subcommittees associated with that align with the Public Health Infrastructure Grant that bring together universities, local health departments, and others who come together to support public health workforce development and infrastructure. Next slide. We also put money and resources and support for our local health departments. We pursued a contract with the Kentucky Health Department Association. I think my colleague Sarah Jo Best is going to talk about that a little bit later on, about some of the things that they have done around creating shared services among all the local health departments. We also provided direct funding to local health departments to help support public health transformation, workforce development, and other activities. And Dr. Stack touched on this, but one of the other things that we did as a lessons learned from COVID is that need to have people in the field who supported that two-way information sharing and communication with local health departments. So we established 5 new positions. They're called area health liaisons. And they're unique in that they're not tied to any one program, but instead they are to provide that two-way communication with the local health departments. We also established a local health department training coordinator who works closely with those FIG-funded activities with local health departments and supports other local health department training initiatives. Next slide. We stood up a program that we call the Center for Foundational Health. And this is a program that's focused on workforce development and readiness. Some of the programs that we put into place included the Public Health Exploration Program, which focuses on high school students. And to date, we've reached out to more than 2,600 students, trying to introduce them to a career in public health. We started our student internship program, and to date, we've hosted over 100 interns. And the Kentucky Department for Public Health has actually hired 9 of those interns so far. We've also done experiential learning days at universities and have reached nearly 400 university students to introduce them to careers in public health as well. Lastly, the program I wanted to mention was the Employee Learning and Development Program, where we have offered more than 1,400 professional development opportunities, tuition assistance for 36 persons to date who have taken advantage of that, and also made Coursera available with over 400. About half of our staff at the state health department have been able to become part of the Coursera learning. Next slide. Going back to that focus on that people priority, some of the other things that we have done included around salary and retention. You may recall that in the beginning, I stated about 20%. Now it's nearly 100% of our staff are at or exceeding that midpoint salary. And for many of our staff, you know, I've heard them say this was life-changing for them to receive substantial increases in salary. Additionally, we've been able to put into place quarterly retention bonuses for our employees, which also helps to recruit and retain the staff that we have. We have started to receive pay raises, legislative pay raises in Kentucky, and each year there have been increases since 2022, which has also helped with our recruitment and retention efforts. Lastly, I wanted to mention the work environment. We've put a lot of effort into remodeling our offices here in Kentucky. They are now nice, neutral colors. They're very welcoming. We were able to change the spaces to account for some people being able to have flexible schedules and telecommuting opportunities. And we've made more places in the building where people, when they come together with intention. So we have more meeting spaces than we have in the past. Lastly, just wanted to touch on those leadership training opportunities. I think Dr. Stack and Tabman have both touched on those, but those have been, we have about 36 persons. Each time we do these cohorts, we've been doing 1 to 2 each year with that partnership with ASTHO and then also the Region 4 group. Next slide. I'm going to talk just a few minutes now about the results of the work that we've been doing. And so we started a workforce pulse survey. And these are some of the results that we're seeing in Kentucky. Our staff are now reporting high levels of satisfaction. So we ask them, how satisfied I am satisfied in my role. And you'll see that more than 90% of our staff are reporting that they have a high level of satisfaction. And you'll see that the survey respondents have also increased over time. So we have people wanting to, to share some of those results and talk about the workforce, the culture that we have here at the Kentucky Department for Public Health. Next slide. Another question we ask are you considering leaving KDPH? And when we started asking this question in 2023, you'll see about 20% of our staff reported that. In our latest survey, that's been reduced by about half, and about 10% are now even considering leaving our state health department. Next slide. these are some of the positive themes that our staff are reporting through these surveys that we're completing now. Now you'll see that they're reporting that number one, they have supportive leadership and supervisors. They're reporting there's more collaboration, technology, resources, more opportunities for experience and knowledge, and a positive work culture. They're also noting they appreciate the flexibility and with telecommuting and hybrid workplace. Next slide. We're very pleased with the results and the outcomes and what we've been able to accomplish both at the state health department and working with our local health department partners. So with that, I'm going to turn it over to Sarah Jo Best.
Thank you. So I'm here today as a local health department director in the Commonwealth of Kentucky, but also in my role as the president of our SACHO, which is the Kentucky Health Departments Association, or we refer to it as CADA. So just, us being 100% membership is a pretty recent thing. Only about 2 years ago did we have 100% of our members or health department directors as members of our SACHO. And I think that is reflective of the things that you're hearing about today and about really building those relationships. So the Kentucky Health Departments Association has 4 key strategic areas, and 2 of them I think are really relevant to what we're talking about today. Our first is to nurture and enhance statewide collaboration. Second is to lead and advance public health policy and advocacy. Third is to support leadership development and capacity building. And the fourth is to guide and strengthen the public health system. So the value of the relationship between the local health departments and our state health department is apparent in Kentucky Health Department Association's strategic plan. Our strategy is at a broad level, but you can also find evidence of this specifically within our strategic plan. With partnership and communication with the Department for Public Health, specifically named support for public health transformation. And our membership really demonstrated our commitment to nurturing this communication, as Dr. Stack mentioned, by voting to change our bylaws and our positions to align with the area health liaisons. And so we have representatives from the Health Department Association that also match and align with that area health liaison map. We use that structure to assist with communications, to conduct quarterly meetings, and to provide trainings regionally across the Commonwealth of Kentucky. Next slide. So I always use the Kentucky's motto because Dr. Sack and I had a conversation about this, and I was like, we're really just living the motto of Kentucky. And so that's united we stand and divided we fall. And that was adopted in 1792, but I can assure you the shift in public health culture and how state and locals work together is much more recent in our accomplishment of that. Our work toward public health transformation began in 2014, and I bring this up because it was a monumental task that we were able to achieve through collaboration. That legislation passed in 2020, and what it did is it created a defined set of foundational and core public health services and created a funding formula to support that. This was really a remarkable accomplishment because you had agreement among 61 local health department directors representing the entire state. You had agreement with our Kentucky Department for Public Health with the local health departments, and that made it easier for our legislators to get on board with that. We had bipartisan support through that process, and then we had support from our governor as well. And that was really unique in Kentucky, I think, too, because we have a Democratic governor and a very strong Republican influence on our legislature. And so the fact that we could all come together and rally around public health and the importance of that and creating strong local health departments across the Commonwealth, I think is something very unique and that I'm proud of in Kentucky. And I think that speaks to our motto. So almost as soon as this legislation passed, we had our first case of COVID. Dr. Stack mentioned that. And, it's a shame to waste any disaster, right? And so during that time, it really became evident to us that the state needed us and we needed the state. And so really that is when a lot of this traction began, and we learned a lot of lessons from that, and we took those to heart. So it became a common occurrence for us to pause as a group and to review information and data, and for the local health departments to be able to give input as to what we thought that local impact would be on proposed guidelines and communication. And there was always a strive for consensus among the group. Egos got set aside and we became Kentucky's public health system, like Tab had mentioned. We really began living our state motto. When we adopted this culture of we can accomplish more together, we gained an appreciation for one another's strengths rather than seeing them as a threat to any of the other side. And we began to evaluate who should lead on certain activities or initiatives. And I think this was really important too, because when we realized, you know, maybe this is something that the Department for Public Health should take the lead on, and CADA should be in a supporting role. But vice versa, sometimes the state would say, you know, we really think CADA should take the lead on it and we'll support you. And I think that that was a huge culture shift from anything that had been done in the past. And we really felt supported by the state when it was time for us to step into that leadership role. Next slide. The legislation passed. You know, we didn't get funded until 2022, but what was so important to this as far as workforce is we had really been on a downward trend in public health workforce at the local level. And so we needed to bump that back up. And so this public health transformation and the funding formula and all of that really was conducive to increasing our staff at the local level. Like most of the other health departments across the nation, we had lots of turnover in our leadership. And so 28 out of 61 of our local health departments currently have 5 or less years experience in that role. And so DPH and CADA both saw that as an area that we needed to collaborate on. The support was there for that in sustaining our momentum. And it became a shared interest and a project for both entities. We collaborated on new director orientation and obtained investment from the Kentucky Department for Public Health for our CADA mentorship program. Next slide. So this is another example of when the state said, you know, we really think CADA should take a lead role on this. And so the grant for AmeriCorps and Kentucky Public Health AmeriCorps was brought to our to CADA's attention by the Kentucky Department for Public Health and Cabinet for Health and Family Services. And they said, we really think that this would be a good investment for CADA and that you all should be the lead role. But they even helped us write the grant. Becky was instrumental in helping us write that grant. We're on our 3rd year. And we are planning to write another grant. 32 members were placed in Kentucky health departments so far. There's more onboarding right now. A lot of these are getting retained in our workforce, and our goal in the grant was to retain 3/4 of the members in the Kentucky public health workforce. Next slide. So another example of Kentucky Department for Public Health really coming to CADA and saying, we think that it would be helpful for us to be able to reach the local public health workforce by partnering with CADA with workforce development funding. And so there was Becky wrote a plan to the CDC, and that got approved. And so what that did is we entered into a contract that would allow Kentucky Health Departments Association to develop an application, review, and approval process for local health departments and their employees. The benefit from these workforce development funds is a means to further develop our current staff, increase internships to recruit new staff, and to invest in leadership opportunities for the health department directors. Approximately $4 million was committed to tuition assistance, training, certifications, internships, mentorships, and leadership development. And you can see some of the results from that on that screen. Next slide. Becky also mentioned the shared services contract. And this was really around the FIG funding and the portion that was designated for the local health departments. KDPH came to CADA and said, you know, what would be your preference as health department leadership? Do you want this to come out as an allocation to each one of the health departments? Would it be better for it to go to CADA and for you all to kind of create an economy of scale? And that's really what our membership voted to do. We decided that we would rather that money go to CADA and for CADA to administer that, and so that we would get more bang for our buck, really. And so that's what we did. And we created a shared service committee to evaluate common needs of the local health departments across Kentucky and how that funding could be most impactful to all of us. From this committee, it was recommended and approved by membership to use the funding for IT support, to include funding for cybersecurity, legal assistance, which included model personnel policies, as well as 2 hours each month available for small projects for each local health department, and training for local health department directors. We also obtained financial assistance and funded activities related to data modernization assessments, and working in partnership with the Kentucky Department for Public Health and their data modernization initiatives. Under this agreement, the department and CADA also committed to developing our local boards of health with investments in training and orientation materials, and the Kentucky Association of Local Boards of Health. We both agreed that in a shared governance structure, like Dr. Stack mentioned, that a strong public health system needed strong local boards of health capable of oversight duties and assurance of public health services in their communities. Next slide. In my role as CADA president and in partnership with Dr. Stack, we have both continuously looked for the opportunity to create a culture that would continue even as we may leave our roles. And we want this to continue. We want this work to carry on. It has both been challenging, changing a culture, especially one across as big of a space as ours, 61 health departments, a state health department with all those divisions that you saw, but it has been very rewarding work. I think that the work not only will create a much better environment for our current public health staff and our future public health staff, but I really believe that it'll be impactful on the health of those in Kentucky. We truly are stronger together. And I think that this is the beginning of a change in our health statistics and the quality of life for the people we serve. That concludes me.
Well, Ron, that's it. It's over to you now.
Well, great. Thank you so much. What a wonderful set of opening remarks and comments from all of you. And I know we had talked about some specific questions in advance, but there were so many questions in the chat that I'm gonna throw you a little bit of a curve, but hopefully not too much. And it'll give all of you an opportunity for more thunder and lightning, or lightning and thunder, as you provide some responses here. There were a lot of questions about the DISC assessment. Questions about how did you actually administer that, across types of agencies? How is it being used, and how is it being shared? Is that something you can respond to?
Yes, absolutely. I think Becky and I can tag team this one. I'll share a little bit about the logistics of the DISC assessment. So as I shared, we have an annual retreat with our senior leadership team and local health department directors. It's usually about 3 days, 2 nights, all fun. And so, well, a lot of learning and collaboration and everything. There's a purpose behind it. But what we did this time was it was organized and facilitated by Eastern Kentucky University. And so prior to coming to the retreat, all of the local health department directors and the Department for Public Health's leadership team took the DISC assessment and agreed that our results could be shared with one another. So yes, we do have a binder. Everyone can see each other's results at the leadership level because we agreed to that. And then we took this was over the course of 2 days for the DISC assessment session, where we did different exercises and having to work together with different leadership styles. So that's what the letters stand for. There's dominance, which is the D. I believe it stands for the I, influence, S, C. So each one kind of tells you lean more toward a certain letter. And so we were able to take local health department directors with one leadership style, pair them up with a state department person with another leadership style, and have them work through issues and situations to see how we could learn to value the different styles that we have that make up Kentucky's public health workforce system. And Becky, really, this started because of your relationship with Eastern Kentucky University. Are there any additional insights into us doing this?
I just want to add, it's been a very key part, I think, of our workforce development is those relationship and partnerships and contracts with those universities. So EKU does have the facilitation center, and we'd partnered with them, and they were able to come out and provide that to that group and other groups as well.
Just add, one of the ways that CADA would like to use this information is really when we develop committees or teams around a certain initiative or project or goal, knowing the strengths of your members and how to develop those teams, it does give you some insight as to how to structure those committees or teams around certain issues or projects.
And so for the group, if you're interested in doing this in your own state, you just Google DISC assessment and then look, there's vendors who do this all over the place. So third parties use that methodology in order to provide a personality assessment, and then others wrap around training and education with it. So we're able to contract with public universities very easily here in the state. And so when one of our public universities has something like Eastern Kentucky University has a whole center for facilitation, and one of the things they do is this. So it's a wonderful opportunity for us to partner with a fellow government agency, if you will, to provide services and supports to our staff and by extension, the people we serve. So you could find this in your state. You just have to find a vendor.
And I will say one of the books we read was Crucial Conversations. It makes your crucial conversation easier if you can go to the directory and see the leadership style of the person you're about to have a conversation with.
Great. Thank you so much for taking that one. And Dr. Sack, I'm gonna throw one at you.
Okay.
It's pretty evident that you are a visionary, compassionate, and quite effective leader. And a question that came up in the chat was, how do you advocate for pay raises? How do you advocate for retention bonuses? How do you make that happen? And does it happen both at the state and local levels?
Yeah, so this is difficult. So obviously, in order for us to increase the wages, well, depends on funding sources. 75% of our funding is federal and a state health department, and 25% or so is state, either general fees or fees that we receive for providing services to people. But we can't pay above a certain pay rate within the state employment system unless the legislature appropriates money and approves us to do that. And so, we went through, all of us across the whole country, I think there's going to be the rare state that hasn't had this journey where there was diminishing funding, there was diminishing resources, and so the pay did not keep up and it fell behind. And here in Kentucky, not just for public health, but for other state employees, wages were not increased. And it turned out to be for almost 14 years, which was an incredibly horrible drought for the state employees. Well, then when COVID happened and federal dollars came into the state, I think lots of states started to try to address a number of things. Hopefully the COVID pandemic first and foremost, but then additionally other things that those funds made possible. And here in the Commonwealth, steps were taken to improve the salaries for all state employees, and we were brought along in that. Now, with respect to efforts within our agency itself, we reorganized our team and have now a dedicated human resources team within our agency, specifically to help navigate the larger government structures that we are part of. And then with regard to those quarterly retention bonuses, in the FIG grant and the Workforce Development Grant, I think before that, one of the tasks and one of the allowable uses of funds was to use the money to help recruit and retain a response-ready workforce. And so some of the ways we did that, or one of the ways we did it, was to put in place a quarterly retention bonus. So for employees who are in good standing at the end of a 90-day period of time, for that quarter, then they would earn what is a $500 retention payment. Now, this is anomalous. So folks, if you and your states encounter difficulty, it's difficult at times because this is not typical in state government. And so we've had to explain it multiple times what it is we're doing and why, but it's approved by our project officer. I think it certainly has helped to recognize people for their commitment and their efforts. But I want to not leave just on the salary part, because if you're not paid appropriately, people get very understandably upset. And if you're paid severely inappropriately, people can't even make ends meet. And so we had some real heartbreaking stories that reached us at the local level and at the state level, people who were going to lose their house, but they finally got a raise after all these years and they were not going to lose their house. People who were worried about a spouse who was sick and that might pass away from their illness. And obviously that's the biggest tragedy, is the loss of their spouse. But they were also worried secondarily that they might not be able to stay in their home because they didn't think they could support themselves without the spouse's additional income. For a lot of people who were working 2 jobs, who now didn't have to work 2 jobs, and people who had stayed in public health for 10, 15, 20 years plus, despite the fact that they were underpaid like that. So it was life-changing and heartwarming and heartbreaking all at the same time to hear some of these stories. So we've advocated, we've been persistent, we were methodical, we persevered when there were roadblocks. And for the local level, this is one of those uncommon areas where my authority is actually very explicit. It says that the state health commissioner shall establish a pay scale for the employees, the local health department employees in the state system. And so we were able to, in one fell swoop, and I worked with the local health department leaders here and with our team at the state, review all the salaries, reorganize the entire pay scale, which had gotten very disorganized over the years, and put in place a new pay scale where the local health departments had about a 3-month period where they all had to implement it. And so that affected 1,500 or more people immediately and very decisively. And so, but I don't feel it's a give out or a handout to anybody. These are folks who worked for 10 or more years, dramatically underpaid relative to what they should have been getting even in a government setting, who were finally caught up to a more appropriate level. So I'm more grateful to them for their persistence and their dedication to the people in our state. And this was long overdue.
Well, congratulations. And I'm certain there will be battles ahead, right? Every day, right?
They're always.
But you are persevering and you're all smiling. So that's really positive as well. So, you know, the partnership that you've established, the collaboration you've established is pretty strong, seems pretty strong. And I'm wondering if each of you maybe could speak to the importance of strong state local partnership, not just in Kentucky, but really throughout the country. Why is it so important? Why does it work? Why should everybody do it? Or should everybody do it? Any thoughts there?
Well, this was the one that was originally, you want to start, Sarah Jo? Or?
I can't. I think sometimes Dr. Sack and I, excuse me, talk about this, that it baffles us that's not just naturally something that occurs. Public health is a team sport. How many times have we heard that? Right? We don't. I think about the diagram that shows the public health system and how many different people are involved in that, and how many people we have to collaborate with, and how strong relationships are really determines how effective the public health system can be. There's so many studies and so many things that have told us this. So, I mean, just the sheer volume of what we can accomplish when we all come together around a common goal, to me, it's a very simplistic thought, that if we band together and we develop these relationships and we coordinate and we can collaborate, that the impact can be so much more than any single individual or single agency can do alone.
And I'd agree. So those books that we read, those were picked with purpose. The first one we read was Good to Great. It's more than 20 years old, but it's an oldie but goodie in business leadership books. And they talk about getting the right people on the bus, the wrong people off the bus, and the right people on the right seat. That's a whole progression in that book, talking about doing that. Another part of it is level 5 leaders, or level 5 leadership, which is servant leadership. And that then led into the book, It's Your Ship, which really is an entire book about servant leadership, about how do you empower your workforce, how do you empower your team, and give them the resources they need, the skills and the training they need, and the security to know that it's okay if things sometimes don't go perfectly. That in order to achieve really good stuff, really great things, you have to be willing to take some risks, and every now and then a risk doesn't pan out. That's not a failure. That's an unavoidable part of achieving great outcomes over time. And so, but that's not typical in state government because people are concerned that they're going to get in trouble if something doesn't turn out right. So we focus on building psychological safety. And so that leads to mastering civility, about the importance of having an affirming workplace, having a culture where you support people, where you compliment people for good things, and where you're supportive when they have opportunity for improvement or growth, and where you intentionally choose not to have negative, corrosive, abusive sort of behaviors, and that you don't tolerate that, and you find ways to make sure that the whole team understands that's not allowable or that's not acceptable. And so with Sarah, Joe, and myself, I am tremendously grateful that she was in her role when I started my role, so very shortly after. Her ascendancy to her position happened shortly after mine did, because, well, we build processes, and the processes are essential in order to facilitate our success and hopefully make it more sustainable over time. Individuals still do matter. And those individuals, I think in this case, Sarah, Joe, and I saw little benefit or point in conflict and disagreement, and were able to rise above challenges of the moment, I think, in order to find common ground and partner and work together. Now, I don't remember any time that was ever difficult, not even from the beginning, but to the extent it was unfamiliar at the very start, we very quickly gained a familiarity with that approach, and then used it, I hope, very successfully over the last 4 years in partnership together. The big challenge now will be, I hope, have we invested enough and built enough in the rest of our leaders so that whenever our time in our respective positions runs its course, that there will be other people who like what they have here, enjoy a collaborative, supportive environment, and that within the ability of the things that we can control, that we focus on being supportive and coming together as a team. And so if you see laughter or enjoyment of each other's company, all four of us have been working together now for 4.5+ years. And I think we have a very stable team. At our senior leadership, out of 28 to 30 senior leaders, we've only had 4 change in it would be almost 5 years. And tremendous stability relative to what is typical in many of these positions. And let me leave you with this, Ron. I know this is a long answer, but we talked about the salaries. The salaries are essential because you have to make sure people can feed their families and do the things they need to do in their lives. But folks, don't get distracted entirely by that. People don't quit jobs over their salary usually. They quit because their boss is a jerk, and because the environment's toxic, and people don't trust and respect them and treat them in a supportive way, okay? So once the salary is sufficient, it has nothing to do with the salary usually. So it's important that we work to not tolerate jerks at work, that we have supportive people who are nice, and that we can hold ourselves mutually accountable for high performance while still also being incredibly supportive of each other as well-intended but imperfect human beings.
And a couple of quick thoughts to your question, Ron. One, the importance of the collaborative spirit at state and local, and the impact that it has on all of our workforce and the those in which we serve, but also thinking from a communication standpoint and how we operate together. So helping to restore trust in our public health professionals. And so what I mean by that, so for example, we had a situation with a measles case recently. Well, we didn't just get on the call with the local health department and the state, but we then took our talking points, what we know about the situation, what we're going to say to the media about the situation, the question, all of those things, and we share them with all of the others in the state. So that way we're hearing the same message. We're the left hand and the right hand, we're in alignment and we know what direction we're going. And so it's a part of our guiding principles is that culture is when we have questions or uncertainties, we ask and we reach out and we call each other on the phone and we work through some of these challenging issues. So I think not only do we better serve our staff and our workforce by working together, we better serve the people of Kentucky, and also we're helping to restore, hopefully, the trust in our work because we have a unified message.
Well, the chat box went wild with these comments that you just made, and it's refreshing to hear. And in fact, the retention and recruitment learning community that we currently have a work group on, and we'll be starting up the learning community, we hope within the next couple of months. One of the areas not being addressed by the learning community is salary. The learning community will address what it is the people working in state and local public health have control over, direct control over. And so an environment is a key piece to all of that. And satisfaction in the workplace is key to all of that. So thank you for raising that. And Dr. Stack, I'm going to put you on the spot again, and I hope I don't get in trouble for this. Somebody wrote in the chat box, they said that I should ask you about the letter you sent to all employees during COVID, during the pandemic.
Oh, you got to jog my memory. Oh, the handwritten notes. You don't mean that. Okay, Ron, I think okay. It may not be the letter, the singular letter.
Letters.
Yeah, I hope what they mean is there's a few things. I've used letters in a few different ways. You've uncovered more, but you're making me dig back. You're traumatizing me, Ron. I'm going back to COVID.
I guess I'm getting in trouble.
Yeah, no. So first thing is I wrote, I still do. When I started my job before the pandemic, I had made a little quarter sheet piece of stationery that said Stephen J. Stack, Commissioner for Public Health, and put the public health logo on a nice little linen paper with a matching envelope. And so I ask people, and when I become aware myself, I write handwritten notes to folks. And so there have been there should be local health department employees across the state who unexpectedly got a note at home from me, from my employees here at the state level. And then the other thing I did, though, is during COVID, much to the governor's amusement, was I said at a press conference once that I'd like to hear from people in Kentucky. And if they would write me a letter, here was the address. And I made them write me a letter. I didn't let them just send me an email or a text or something because that was too easy. And so I wanted them to have to actually go through the act of finding a pen and a piece of paper and writing something themselves and putting a stamp on it and addressing it and dropping it off at a post office or a mailbox, because that showed some degree of commitment if they were willing to go through those extra steps. I have a huge Tupperware full of letters from people all over Kentucky. And in the height of the pandemic, I was so exhausted and had no time, I couldn't write back to them all. But as the pandemic started to slow just a little bit, and even during some of its height, I would stay in my office after everyone had gone home when it was late, and I'd write a handful of those people back a note on that letterhead paper. So I hope that's what they mean, because I didn't write a singular letter that was just sent to everybody like a form letter. These are individual handwritten letters in my very crummy scribble looking print style, because I don't know that I could write cursive compellingly at this point anymore.
With that, he writes a lot of letters, thank you notes, just recognizing when employees do a great job. And like he had said, we've had a lot of local health departments reach out and say, hey, will Dr. Stack write a note to my staff?
Yeah, so he's writing notes to them too. And before I started the position as chief of staff a couple of years ago, I was working at a program level, and I didn't know Dr. Stack, but I of course worked for him. And I was shocked when I opened my mailbox and he had written me a handwritten thank you for doing what I was doing. And I framed that. And so it's just crazy that it's still framed in my house. And now fast forward and I have the honor to be his chief of staff. But just speaking from a program staff at one point and what that means to someone, whenever someone recognizes that you did something and they write that handwritten thank you, that embodies exactly who we want to be as a culture and live up to. So yeah, it's really cool.
Ron, I think you're going to wrap us up here in a second. So let me real quick share on those notes, folks, there's a whole bunch of quotes over time. I wondered when I was younger, how people could tell all these stories. And then I got old, and then I realized it's just because they lived long enough to have a lot of stories to tell. But So Maya Angelou has a quote that I use frequently when I give public speaking things, which is, people will forget what you say and people will forget what you do, but they'll never forget how you made them feel. And so I think some of these things that we get to do in these leadership roles, it still just strikes me as remarkable. I don't understand how folks miss the easy opportunity to just say thank you and express gratitude for what people have done. And so I really, really do think that those little handwritten notes, what really struck me was I had employees that we would get on a Zoom call and someone had it hanging on their refrigerator in the background or up on a pegboard, or a mother or a father who came and visited them for the holidays or something, and they saw that note there and say, is that from Dr. Stack? Because remember, those of us who were shows at the time got to be, little mini celebrities on TV all the time with our governors. And so it means a lot, but you don't have to be the state health official to do this. Gratitude goes a long way at
Jen,
all levels. And so whatever
this
your role
called?
is, whether it's from peer to peer, whether it's upwards
Yes.
to a boss, or whether it's downwards to an
So I don't
employee,
have any audio coming up. I can't.
handwritten notes can mean a lot to somebody because they're often unexpected and they clearly show that you cared enough to go through the extra efforts to do something that's not typically done these days.
Wow. Well, yes, we are going to begin wrapping up here. And I must say that we designed this panel to highlight the partnership and the collaboration between state and local health departments and what can be accomplished. And certainly you've demonstrated a lot can be accomplished. Tremendous amount is being accomplished. And I guess you added another whole layer to all of this, which is going into retention. How do we retain staff? I mean, Dr. Stack, you noted that you've at a high level, you've had a lot of retention within the health department, which is unusual today. I mean, we've worked with health departments where there's been 60% plus turnover in the past few years. So thank you for giving us those additional nuggets around retention, around helping employees feel appreciated, feel that they belong, feel that they're respected, and are treated well within the organization. Oh, and by the way, you've got their back because you're trying to help them increase the salary as well, so that they can make ends meet on that. So let me thank each of you, Dr. Stack, Tabin, Becky, and Sarah Jo. Thank you so much for this incredibly exciting and informative panel discussion. And Mayella, let me turn it back over to you.
Wonderful. Thank you so much, Ron. To all of our speakers, thank you so much for taking the time out of your busy days to be here with us. And thank you to everyone that joined our opening session. We do invite you to join us at the next session, which will begin at 3 p.m. Eastern. We'll be laying the groundwork, Essentials of Public Health Workforce Development. Just as a quick reminder, you will need to log back into the Train Learning Network conference page to access the Zoom link for the next session. The links will be available 30 minutes before each session. So thank you again, everyone, and we will see you all very shortly.